We have something new this week on the post show.
Does it have a name?
It doesn't have a name.
Don't call attention to it.
Oh, I'm sorry. No one mention the mic.
I feel like a microphone that dare not speak its name.
Yes. Okay. I want to briefly bring this up because I just picked up my phone and a doctor friend of mine says we should be talking about direct medical care plans. Is this something you're familiar with, I believe? Can you give us a synopsis of what he's talking about? Is he just trying to get a sales pitch here from me?
It is a for-profit business, and it is something we sell, but there is actually a huge benefit to it. For people who don't have insurance and can't afford it, they can pay these, what we have at St. Louis Urgent Cares is a system where people can pay between $60 and $75 a month, and they get everything under the office for free, essentially. So lots of blood work. They can get x-raying, suturing, all sort of, care and services, essentially. It does not cover specialists. So if we reach a point with someone in testing where they need to go see neurology or cardiology, that's a problem. And we've got to, at that point, arrange care. And there are, compassionate cardiologists and nephrologists and specialists who will see people at a reduced rate. But for people who don't have insurance, and certainly before the Affordable Care Act goes into place, that is something that a lot of people in St. Louis have taken advantage of.
So you're telling me there's not an easy answer that fixes everything?
It's not going to cover cancer.
It's not going to cover cancer.
But,
it's not going to cover something catastrophic.
But I have a lot of patients that come in that use this, and they come in every single week, and they use it extensively. So it can be very beneficial to some people.
I liked what you said. Actually, sorry. I'm glad.
Oh,
I'm glad you pursed your lips because it caught my attention.
So there was a lot of, but I wanted to go to Facebook.
Yeah.
So mental health, a lot of conversation towards the last 10, 15 minutes. Mental health, how does ACA affect mental health? And then also, this gentleman, Bill Hill, wrote, why should the young subsidize parents' coverage, older people's coverage? If that's the case or not, that maybe that's sort of put out there. And people feel that the young, this is a ploy to kind of...
Same reason, is this like asking why you should pay your property tax for schools once your kids are raised?
Yeah.
I don't know, is it?
I just want to push back a little bit on the idea that all young people are invincible and that we're going to be invincible forever. We're not. We are going to get sick eventually, unfortunately. We could get sick now. Something bad could happen to me, God forbid. And I think this idea that young people don't need insurance or they're going to subsidize older people is wrong. Young people need insurance because they have health issues too. I want to go see a doctor. I want to make sure that I'm going to stay healthy when I am my parents' age. And I think that is the frame we should be looking at it, not we're subsidizing people or it's going to cost us a lot of money. We have to think about the long term, not just the short term.
Back to Ed's first point, go ahead, I'm sorry.
Oh, I was going to say, one issue with that, I agree, but if the whole point is to get young people into the system and get young people, paying premiums, raising the price probably isn't the best motivator. Now you're giving them a better product, but they are essentially subsidizing, so you are running into a few more difficulties with getting people to choose that they want to participate in the system. You need to sell them on why they need to participate.
I think we've heard some things about price that make it affordable for young adults to have insurance and have good insurance.
Yeah, the price will be lower than what they have to pay today for just catastrophic, to get preventive care, mental health, pharmacy. And the mental health issue is extremely important.
I want to come back to the middle. It is extremely important, so I'm going to write it down. But I just want to tidy up just a little bit there. Let's say you're the graphic designer, you're working on your own, and you're not just looking for catastrophic care, but you're looking for something in the exchange that's maybe not Cadillac either, but not catastrophic. Is it going to cost more than you could buy right now?
It does not.
I think people seem to be. I can't seem to.
There's a calculator. There's a calculator on healthcare.gov, so you can go find out for yourself. But I entered my 32-year-old son, and under that calculator, he'll pay $44 a month. He pays $150 now for catastrophic care. For $44 a month, he'll get the Silver Plan, which is all primary care, mental health, pharmacy. It is extremely affordable compared to what you have to pay now for health insurance, and it's why they don't get it now. They can't afford $150 a month if you're making less than $25,000, but you can afford $44.
And really, we don't know the exact prices yet. They haven't been posted yet. but there are a lot of reasons to be optimistic, and I think what's really important for young adults to know is that there's hope, there are new options, and they should check it out. They should at least go see what's out there for them, because I think they're going to be pleasantly surprised by some options that are there that they haven't had before.
And if I could add, young people should remember that they're going to be old someday. So we're all in this together. That's what community rating's about. So when you say, well, why should young people pay for the old? Well, young people pay for Social Security too.
Well, they don't have a choice in that. They don't
Well,
pay. They
right,
don't pay
and
their 401k
but that's
at the
why
moment.
this is a a mandatory program. So if you made it voluntary, then nobody would participate. So that's why we do Social Security this way. So if we priced the plans appropriately for the elderly, they couldn't afford it either. So the reason it's shifted this way is because the elderly would not be able to afford it, or the near elderly. So it's priced this way on purpose.
If someone were to ask you, would you prefer to pay into the system, and you say no, and then you ask them, well, what if everyone else says no as well, and you get a cancer or a catastrophic illness? That's the question you have to ask.
Are we a community or are we not?
Yeah.
Young adults are going to have to look beyond themselves because in order
Wait,
for
I
this,
just want to make sure we're banking on young adults looking beyond themselves for this thing to work.
well, absolutely, because if the young adults don't buy in, this program is not going to work. They're the healthiest among us. If they don't buy in and they all pay the penalty, the costs will skyrocket. I mean, that's.
And yet that's not the reason for an individual young person to make the decision
Well,
to sign up.
But here's another angle I want to bring up. I've got a 25-year-old too. I pay about $300 a month for him to stay on our policy. He's got health problems. When he ages out at 27, as a parent, I'm going to pay his health insurance if it's $50 a month, because I want that peace of mind. And you've got a whole set of parents out there that are paying for their kids' health insurance now, but they don't have options when they age out at 26. This gives parents options too. And we're also talking about that population up through age 35, approaching 40. As you start approaching age 30, you start hearing about bad things happening to your friends. When you're 22, yeah, you're invincible, but you're on your parents' insurance. When you're 30, you're on your own, and bad things are starting to happen to friends and family, and you start thinking about health insurance.
I want to get a little more in from the audience via the Public Insight Network, and I also want to give Pete a chance to rest his arms. So on the boom that we don't talk about. So I believe this one says, my brother who sells insurance tells me premiums are going to skyrocket. Are premiums going to rise? This is a question a lot of people, and we're still going to get back to mental health, so we got to stay on time, and because I want to get back to that and devote a
Hard
decent
to tell. Gosh, that's what an insurance company would certainly tell you if they were opposed to the legislation. The piece that I always thought was interesting about the ACA was something called the medical loss limits and medical loss ratio. So there actually is part of this legislation that says insurance companies can have a loss ratio of 85%. That means if you go to a hospital and you spend $1,000 on care, the insurance company maybe gets $150 and the hospital gets $850. And to me, those numbers still seem kind of high. When you go to a hospital, who do you see? You see the physicians, you see the nurses, you see the support staff, you see the techs, but the insurance company isn't there. You didn't interact with them. It's a business that has had enormous margins for many years. There are
That's
insurance
actually
companies
not
that have
true.
60% margin.
That is totally not true. Health insurance companies have incredibly small profit margins.
I think there are many health insurance companies that have very large margins. You can
I
find
agree.
some that have
The average
60%
6 to 8% is the margin.
Is probably
That's
still quite high for,
that's
I think, services that are not
industry
really
by
provided
industry.
that.
That's not
Well,
exceptional by any
I'm
means.
sorry, and not to be here, because as an insurance broker, I have my own issues with the insurance companies. I have to sit on hold with them too. I probably have to wrangle with them more than anybody. But I would say that you can't discount what the insurance companies also have to do. They're spending billions of dollars trying to get compliant with this law and create all these new plans and make sure that everything is following the law. They have that to deal with. But aside from that, a lot of them provide nurse hotlines that you can call 24 hours if you're insured, that provide other services as well, disease management programs to help you figure out how to manage your chronic
Certainly
illness
true.
and get access
Many of
to
those
care.
are newer programs, I think, as a response to some of these laws.
So can I jump
No,
in on the
that's not.
skyrocketing question? Because the answer is we don't know in Missouri. We do know in some states right now because they've released their rates. We do know in California, we do know in New York, and so, but we can't answer that question yet.
Okay.
So it's really irresponsible to say they're going to skyrocket. And we don't know individually as well. It's an individual answer. Some people, they're going to go up, some people are going to go down. And also, one thing that really bothers me is to answer that question individually, you need to know the person's income to know whether they're going to get a subsidy or not. And for people that are high income, they're not going to get a subsidy. For people that are relatively low income, below 400% of poverty, they're going to get a subsidy. So, people just need to calm down and wait until October 1st.
Especially Nick and Emily. I feel like they're
Yeah. No, I think that debate is appropriate because I think the question is quite right. I think they were both right, and a professor, and I think there's truth in both answers.
And the short answer is, don't let anybody else decide this for you.
Right.
October 1, go to covermissouri.org or healthcare.gov and find out for yourself.
Okay, can we go back to mental health? Because I'm curious if you think that we will be in a completely different society when it comes to mental health coverage. Is this going to drastically change the way we look at mental health, our access to mental health care?
There is a lot of mental health in primary care for a number of reasons. Because that's the first place the patient shows up. They come because they can't sleep, but the real issue is that they're depressed. And having access to a primary care provider to start addressing that issue is very powerful. And for young adults in particular, this is a key issue. There are a lot of young adults that have undiagnosed mental illness, and they miss work because of it, and they don't know why they're missing work, and they've got somatic abdominal pain and headaches when in fact they are going through so much psychological stress that they need someone to diagnose that and target treatment in that direction. I've also had patients who've lost jobs over and over again because they're so dysfunctional at work because of their untreated mental illness.
Yeah, we've sidelined and neglected these people for years, and it's a tragedy, because if you really get folks diagnosed early, you get them on the right kinds of medications, they can become very productive professional people. They can hold down jobs and do very well in life if they have the right help. But for whatever reason, mental health issues have just been kind of sidelined. People just say, well, we'll take care of all of your health care except if you have this, and then, yeah, sorry, we're not going to help you out. And yeah, especially in this age group we're talking about, there are folks who are just starting their professional adult lives that could go on to terrific careers, be great contributors to our communities and to society in general. Generate money into our healthcare system because of the productivity that they have, and they just don't have the chance. So if you give them the mental health care services they need, you're going to see that be better for us economically as a nation.
Most coverage today is for acute, drastic, short-term mental health care. Right. And then you're kind of on your own again. And somebody has really serious problems such as schizophrenia or something like that, you need an intensive 6-month management of your medications as you try different things and work those things out. And that's just never really been covered before unless you had a really expensive plan.
You have to see mental health as a medical problem and not just a psychological problem. So that someone will take insulin to regulate a chemical imbalance of sugar. Someone will take something like Lipitor or Crestor to regulate a chemical imbalance of cholesterol. So someone will take something like Prozac or Zoloft to regulate a chemical imbalance of a chemical called serotonin. And once that's there, then yes, they're more productive at work. They can fulfill their social and professional obligations.
Sorry, I didn't mean to be silly on that. I appreciate what you're saying. That was my way of segueing to, I think we've run out of Pete. He's petered out. No, okay, we're groaning now.
They need to pay for your gym membership.
They do, and we are running out of stream time online. So thanks, guys. I appreciate it.
Thank you.